Have you ever woken up and noticed something unusual about your body? Perhaps you've suddenly lost weight, experienced an unfamiliar pain, or woken up drenched in sweat for no apparent reason. What if I told you that these morning signs could be your body's way of warning you about a serious issue, possibly even cancer? The truth is, most people overlook the small signals their bodies send them, dismissing them as signs of aging or ordinary fatigue. But ignoring these signs could mean missing the chance to detect a dangerous disease early while it is still treatable. In this video, we will share 4 important morning signs that, according to medical experts, could be early warnings of cancer. Some of these signs may surprise you, and you might have even noticed them in yourself or a loved one. But by the end of this video, you'll understand their significance and, most importantly, what you should do next. Stay tuned until the end, as this information could be life-saving. If you haven't subscribed yet, hit the subscribe button and turn on notifications so you never miss important health updates. Now, let's dive in. #1. Persistent cough or prolonged hoarseness. A lingering cough or a persistently hoarse voice that does not improve over time can be a serious warning sign, especially in older adults. If a cough is caused by a cold or seasonal allergies, it typically clears up within days or weeks. However, if it lasts for weeks or even months without improvement, it could be an early sign of lung cancer, throat cancer, or laryngeal cancer. Take the case of George, a 72-year-old man who initially thought his lingering cough was just a stubborn cold. But as time passed, his voice became increasingly hoarse. When he finally visited a doctor, an X-ray revealed a tumor in his lung pressing against his vocal cords and airways. Had he ignored the symptoms longer, the outcome could have been much worse. If you have a cough that persists for more than 3 weeks, experience difficulty breathing, or notice voice changes, seek medical advice immediately. Early detection can significantly improve treatment success. #2. Persistent morning fatigue despite full rest. Mornings should be when you feel refreshed and re-energized. But if you constantly wake up feeling exhausted, even after a full night's sleep, it could indicate something more than just poor rest. Cancer-related fatigue is different from regular tiredness. It's an overwhelming exhaustion that does not improve with sleep or rest. Blood cancers such as leukemia and lymphoma are particularly known for causing extreme fatigue, which is often most noticeable in the morning. This happens because the body diverts energy to fight the disease, often leading to anemia, a major cause of chronic fatigue. George, 74, loved his morning walks, but he noticed that, no matter how early he went to bed, he still woke up feeling drained. At first, he attributed it to aging. But when the fatigue worsened, making even simple tasks like preparing breakfast exhausting, he decided to see a doctor. The diagnosis? Early-stage leukemia. Because it was caught early, his treatment was much more effective. And today he feels stronger than ever. If you experience persistent morning fatigue for weeks, take note of other symptoms like dizziness, loss of appetite, or unexplained weight changes, and consult your doctor. #3. Unexplained night sweats that leave you drenched. Waking up sweaty might not seem alarming at first. Many people blame it on room temperature or heavy blankets. However, if night sweats happen regularly, soaking your clothes and sheets even in a cool room, this could be a red flag. Certain cancers, including lymphoma, leukemia, and hormone-related cancers, can cause excessive sweating. This happens because cancer affects the body's immune response, triggering inflammation and disrupting temperature regulation. Richard, a retired teacher, didn't think much of his occasional night sweats, until they started occurring every single night. He would wake up drenched, sometimes needing to change his clothes before getting out of bed. At first, he assumed it was a normal part of aging. But when he also started losing weight and feeling unusually fatigued, he visited his doctor. Tests revealed he had early-stage lymphoma, because it was caught in time. His treatment was far more effective. If morning sweats happen frequently without a clear reason, especially if they soak your pajamas or sheets multiple times a week, don't ignore them. Keep track of how often they occur and whether they're accompanied by weight loss or fatigue. And talk to your doctor. #4. Unexplained morning weight loss. If you wake up to find your clothes feeling looser or step on the scale to see a sudden drop in weight without trying, it may seem like a minor change at first. However, doctors warn that unexplained weight loss, especially noticeable in the morning, could be one of the earliest and most concerning signs of cancer. The body naturally burns calories during sleep, but rapid, unintended weight loss often means the body is using energy in abnormal ways, such as fighting a growing disease. One of the most common cancers associated with sudden weight loss is pancreatic cancer, which plays a key role in digestion. When affected by cancer, the pancreas loses its ability to properly absorb nutrients, leading to weight loss, muscle wasting, and morning weakness. Similarly, cancers of the stomach, colon, lungs, and lymphatic system can disrupt metabolism, causing dramatic changes in weight. Richard, a 72-year-old retiree, noticed his belt becoming looser but initially dismissed it as a natural fluctuation. Over the next month, however, he lost nearly 15 pounds without changing his diet or lifestyle. Concerned, he visited his doctor, where tests revealed early-stage stomach cancer. Because it was detected early, he had far more treatment options and is now doing well. If you've lost more than 5% of your body weight in a few weeks without dieting or exercise, it's time to take action. Sudden, unintentional weight loss should never be ignored. Final thoughts, key takeaways and next steps. To summarize, 4 key morning warning signs that could indicate a serious health issue, including cancer, are: white tick mark emoji, persistent cough or hoarseness; white tick mark emoji, morning fatigue that doesn't improve with rest; white tick mark emoji, unexplained night sweats that leave you drenched; white tick mark emoji, unexplained weight loss, especially in the morning. These symptoms do not necessarily mean you have cancer, but they should not be ignored. If they persist or worsen, seeking medical advice could make all the difference. Early detection dramatically increases the chances of successful treatment. Our bodies often give us signals when something is wrong. Listening to them could help detect diseases before they become life-threatening. For older adults, regular health checkups and awareness of symptoms are crucial to maintaining good health. If you're concerned about any of the symptoms we discussed today, schedule an appointment with your healthcare provider. They can guide you on the next steps and determine if further tests are needed. Your health is worth investing in. Don't wait until it's too late. Thank you for watching. If you found this information valuable, please like, subscribe, and share to help spread awareness and support more informative content. See you in the next video.